Okay, we are going to start the webinar ya, Zdenko and Dr. Zorman. Assalamualaikum warahmatullahi wabarakatuh. Selamat malam dan selamat datang untuk rekan-rekan dokter selaku peserta, and most importantly, welcome to our speakers Zdenko Vizintin and Dr. Anze Zorman from Fotona. It is really an honor to have both of you as our speaker in this session. Terima kasih juga untuk rekan-rekan dokter yang sudah hadir, mendaftarkan diri dan meluangkan waktu untuk mengikuti webinar kami yang pada malam hari ini akan membahas tentang topiknya yaitu HAIRestart dan juga SmoothEye. Pertama-tama saya ingin memperkenalkan diri secara singkat. Nama saya Fasya, saya perwakilan dari PT Admiral Blesensa Abadi dan di malam ini saya akan bertugas menjadi moderator sekaligus MC. Sedikit penjelasan tentang PT Admiral Blesensa Abadi. Perusahaan kami merupakan distributor tunggal laser Fotona di Indonesia dan acara webinar ini menjadi acara seminar lanjutan dari rangkaian webinar-webinar yang telah dilakukan oleh Fotona yang bertujuan untuk memberi informasi serta edukasi tentang Fotona laser. So before the webinar begin, I'm going to read some information. The first talk, which is HAIRestart topic, will be delivered by Mr. Zdenko Vizintin, and then after Zdenko presentation is finished, Dr. Zorman will start his presentation on SmoothEye topic. To all the participants, please drop your question as usual in Q&A box, and our speakers will start to answer your question after Dr. Anze presentation is finished. Of course, e-certificate will be available for all of you, and we will send it directly to your email within 3 or 5 days ahead. Okay, I hope the information is enough. Now to shorten the time, I'm going to read CV and profile from Zdenko before we start the presentation. Please hold on. Okay, hopefully you can see it clearly. Zdenko Vizintin, BSII, MSc, MBA. Zdenko has been working in laser technology for more than 40 years, having graduated from the Ljubljana Faculty of Electronics as an electronics engineer. Throughout his professional career, he has been deeply involved in R&D and production of various laser systems for different industries. In his current position in Fotona as Medical Laser Program Director, he is responsible for the applications development and clinical affairs. And also, Zdenko is a researcher and expert lecturer for Laser and Health Academy. Zdenko is actively involved in new medical laser application development and validation through many clinical studies. He is also the author and co-author of numerous laser engineering papers, as well as studies in the application of laser medicines. Zdenko is also involved in development of new aesthetic application 4D, non-invasive laser facelift, tight sculpting, non-invasive laser treatment for sculpting and skin tightening, as well as fractal. The latest area of his investigation are the use of laser for the male health, hair regrowth, ENT, and ophthalmology. Okay, so Zdenko, you can start your presentation about.
Thank you.
Okay.
Thank you, Fasya.
So the microphone is yours now.
Thank you. Hello, everyone. Nice to be with you again. I would like to be in Indonesia now, but unfortunately, I'm at my home. Anyhow, I put my Indonesian shirt on me, so you can see that I'm with you. I will start with my presentation about Fotona hair growth stimulation. The protocol we called HAIRestart. Some of you already get some information. For some of you, it will be first time, something new. But as I have just 30 minutes for this presentation, I will try to be as short as possible. This means that I will not go through the whole this overview, all of these 7 points, but I will be discussing the last 2 points, therapy options and Fotona and hair restoration. If anyone is interested to learn about terminology and history of hair restoration, about market, about different types of hair loss, and then definitions about androgenetic alopecia, which is our main indication, also about measuring tools, You can learn and hear about this on this link on our Laser and Health Academy webpage, where I had this lecture last year, so it's available there. If we are talking about therapy options, there are some of them which I will mention. These are the most common. Of course, there are also the others. People usually start with some vitamins and supplements, but my experience and what I read on the internet is that this is not really working. Then there are medicaments of all sorts, followed by low laser therapy, low-level laser therapy. This is already quite well established on the market. Hair transplantation, one of the most popular, also difficult and expensive. PRP is becoming more and more popular, and there is also microneedling. Either it is done alone or in combination with some of these drugs as a combined treatment. So if we look in these 5-6 different approaches for therapy, these three which I put in red are the most common, and they are also FDA approved. So if you're looking into drugs, there are some new drugs like prostaglandin and so on, but finasteride and minoxidil are already on the market for quite some time, showing some efficacy, not really excellent, but some efficacy. But on the other side, finasteride especially having also some unwanted side effects. Minoxidil is used topically on the scalp, and it doesn't have so many problems, but of course you have to use it daily or maybe even twice daily for a long time. Regarding low-level laser therapy, there is quite some literature already on the market. In this lecture, which I was referring before, I am going through this literature in details. You will see that actually there was also reviews which says that there is evidence that it is working. But again, when you use low-level light therapy, you have to use a lot of sessions for a long time, like a full year around, twice, 3 times per week, or even every day. There are also home devices which you can bought relatively cheaply, let's say in the range of $500 to $1,000, and you put this on your scalp and you can treat yourself at home. But it's not so popular as people expected it will be. Hair transplantation, I'm sure you all know about it, and I will just show you some of things we are doing in this. If you are looking in these 3 ways how people use lasers for hair restoration, the first I already mentioned, it's a low-level laser therapy, and here the mechanism of actions people discovered so far is an increase in cellular metabolism. This is definitely happening after light illumination of cells, and also increase vascularization resulting in increased blood flow. This is an important mechanism which is also present in other laser treatments where we don't have just low level but also higher level. There are 2 other options how people are treating hair with lasers, and these 2 are photothermal effects. So when we are talking about low-level laser therapy, we don't increase the temperature of the tissue or of the hair follicles. We're just irradiating with light, and the mechanism is on photobiomodulation level, not the thermal level. But if we use thermal lasers, like is for example in Nd:YAG, long pulse Nd:YAG, or piano, which we have now, or some other diode lasers, you can actually see that also thermal effect has some interesting consequences on hair. Most of you are surely aware of paradoxical hair growth when we want to do a hair removal. In fact, when we are doing hair removal, sometimes some people see some paradoxical hair regrowth and then they are not happy with this. And just this negative side effect for hair removal is actually a positive thing for hair regrowth. And out of it, we can observe actually this mechanism, what is happening. The idea is that this heat-induced actually launch an inflammatory cascade, and then this terminal hair induction is happening here. I'll be talking more about the mechanism of action later. But this is one concept. So it's non-ablative forming of the follicles. And the other mechanism of action, which became popular like some 10 years ago when fractional ablative lasers were introduced, is actually micro-wounding. Micro-wounding and then wound healing, and through this micro-wound healing, we get the induction of follicle neogenesis. This is actually also proven mechanism, and I will be talking about this as well. So we have 3 ways how we can use lasers for hair restoration: with low-level therapy, with photothermal effect, non-ablatively, and with the micro ablation. So what we did in period of, I can say, even last 10 years here, we were working in these 3 fields. So Fotona was involved in hair transplantation with the aid of erbium YAG laser in ablative way. Then also in fractional ablative microwounding of the scalp. And lately, this is the newest, and this is the main topic of today's talk, is the HAIRestart on non-ablative fractional erbium. Starting with hair restoration, you can see here our patent from 1999. So it's 21 years ago. Fotona patented the drilling of the scalp using erbium YAG laser and producing these small holes with a diameter of about 1 millimeter, in which follicular units were introduced. This is a big part of the market of the hair loss. If you are just looking in the US hair loss market, you can see that the largest chunk of this market is hair transplantation surgery. And then there are drugs. So this is just a few slides of one of Serbian doctor who was using our laser for hair transplantation. This presentation is from 2010, so 10 years ago. You can see also the laser was the older one, not the new dynamics, but it did the job. So he was using our handpiece, which can produce very small spot. It's a R08 handpiece. The spots, standard spots are 0.45 millimeters, but for this particular application, we enlarged the spot to 1 millimeter, and he was doing some several stacks to drill the hole more than 1 millimeter deep, and then he was introducing here hair follicles. Results, of course, of hair transplantations are very good, and patients are happy with this, but whoever is doing this knows that it is quite a difficult and tedious job. To do something like this, you spend maybe 6 hours for one patient. This is also why it is quite expensive. Going to the second approach, which is fractional ablative erbium YAG microwounding. There was a presentation on Laser and Health Academy Symposium already in 2010 by Dr. Kozarev, and she was showing her work with, this is our fractional scanner for erbium YAG. Of course, this patient is not a really good patient because this is almost total alopecia, but for some others, you will see pictures, there were some nice improvements. But the idea here is shown, so drilling the scalp, producing micro wounds with some density of, let's say, 10% of the scalp pre-drilled, and then either just leaving like this or putting some topical either PRP or some other growth factors on the scalp. And then we have also this transdermal, laser-assisted transdermal induction of drugs, which is much better than if you just put it on non-drilled skin. So this was interesting to try. And she was showing some nice results in some combined treatment. You can see here fractional erbium laser and then some additional drugs, including the finasteride here. And you can see on these pictures that there is some improvement visible on all of these cases. And in the same period of time, I got this mail from our good friend Jitendra from India. He is online now. Hello, Jitendra. I got this, that one of his users, Dr. Om Prakash from Chennai, was doing a similar thing like Dr. Kozarev here, and he showed how he was using his PS02 handpiece with 4 stacks per side and achieving good result in improvement of this alopecia. So obviously this technology was working, and not only this Dr. Kozarev showed it, but it was also around. And just a year ago, last year, I was in Shanghai on the LAHA China meeting, and Dr. Enpin Yang, he was presenting his results. I'm sure some of you in our audience can read Chinese better than me. So he was using erbium YAG. You can see again the older model, but it doesn't influence the result. for alopecia areata, in fact. And the parameters he used ablative, you can see here 40 joules per centimeter square. This means that it goes at least 120 microns deep. And if he's doing some stacking, it is going even more. So some of his results, which are showing really excellent improvement. Of course, he mentioned in introduction, he mentioned that he was using also traditional Chinese medicine plus laser. He started to use laser because just traditional Chinese medicine results were not good enough. And with this combination, he was very happy. So some of the cases which are really stunning, if you look into this situation, it's really amazing improvement. The numbers of sessions he was doing are between 3 and 6, I think. And I was amazed on his result and asked him if he will be willing to publish it. So I hope we will be able to get some raw data from him and to publish this paper. Meanwhile, this was last year. In this year, you can see here 2020, it is just in September, a month and a half ago. I found this study on the internet by a Turkish group from University Cerrahpaşa. They have our lasers for maybe more than 10 years. And they were treating alopecia areata with a fractional ablative erbium YAG. So they did 25 patients, 19 male and 6 females, on which they do 3 sessions and with 4 to 6 weeks interval. They used here 4 millimeter with 1.2 joules. I believe this is a PS01 handpiece, which has this kind of spacers more than spots. The results are very good. In fact, they introduced a kind of score with which they measured improvement. In average, it was 17%. But when they were looking into particular areas, like 16 patient has this alopecia on the scalp, they showed about 30% regrowth. And the 5 patient who has on the beard showed almost 40% regrowth. It's a great improvement. And this is one case or 2 cases in which they are showing improvement here on the beard and on the scalp. So as you can see, not only this non-ablative HAIRestart, which we are doing, is in option, but some people are using this fractional ablative erbium YAG micro-wounding. And I would say, so far as I was following it, it seems to be quite efficient for alopecia areata, which is different than androgenetic alopecia, as you well know. And on my opinion, alopecia areata is more difficult to treat. It's autoimmune thing, and it is not so simple. Let's move to the last step. So HAIRestart, our protocol, our newest protocol. We coined this name last year on our meeting in May, HAIRestart. And it started actually, I would say, almost spontaneously among our users. I'm sure some of you know these pictures and this guy. This guy is, his name is Jeff Nuziard. He was a sales manager of our US Fotona company. And he's starting to lose his hair. You can see this is December 2017. And we met in September on a super symposium meeting in Dallas. And he was asking me if I know any method how to improve how to restart the hair. And I mentioned to him the options we were using, as well as the option with the smooth mode non-ablative erbium, about which we learned from Dr. Claudia Pidal from Argentina. Actually, she found this by chance when she was doing some forehead tightening, acting on the SMAS regions on the scalp. She was treating the scalp with the purpose to tighten the forehead. And then she noted that, in fact, where she did the treatment, hair improved. So I told him this story, and he said, okay, I will try it. So he started to do this on himself. You can see here the settings. He was using fractional handpiece with the biggest spot, 7 millimeter, and the highest fluence he was able to get on this handpiece, and also the highest speed, 3 to 4 passes cross hatch, and he was doing this every 2 weeks. And then when he gets some improvement, he started to show this on this Fotona Medical Laser User Group Facebook. And we have here, I believe, more than 1,000 users. So people start looking into it, and then you can see relatively quickly some other people joining this and doing the same. These are still results of Jeff Nuziart, not on himself, but on some other people. And then you can see here some results from Turkey. Dr. Nasi Çelik has also already now more than a year experience with this, and he is quite happy. This is from Dr. Gabriela Merzik. I will show later one of her studies. She is working in London, and you can see also her screen here on presentation he showed on LAHA Symposium. And then some other people from Turkey. You can see quite nice improvement here post 3 sessions. The same Dr. Gülsüm Dinç, she is quite active in this. And then these are cases, if I'm not wrong, from Azerbaijan, and the case from Australia, and the case from Thailand, if I'm not wrong, and so on, American one. So you can see that our users starting this, as I said, almost spontaneously. The protocol is quite simple. They said, okay, we have laser, we have handpiece, let's try it. In this period of time, this was mid 2018, we didn't actually work on it. Fotona was observing this happening, although it was very interesting for us to see as well. Some of our distributors took it as an interesting application and even give some names. This is our good friend Katie Oda from Japan. She called it hair lace. And she started to post this on the Facebook and also exchange some mails with other users who are doing this. This is a Russian doctor who actually presented her 10 cases on a congress in St. Petersburg. So people already start to show this on congresses. And this is our Korean distributor. You can see in April 2019 on the big congress in Korea, they already presented this on the booth. They put a panel with the pictures before and after, and they start to promote this procedure. Similarly, Dr. Katie Yoda promoted it. She made a poster here with the pictures from Facebook at the beginning, but then next year she already has Japanese original pictures. So this is from the users from Japan, and this is Dr. Yuko Tanaka, the lady in the middle, who did these cases in Japan. And also in Indonesia, of course. I am very often coming to Indonesia at least once, if not twice per year. And last year I was in Medan on your Perdorsky Congress, and we visited the clinic, Flawless Clinic in Medan, and Dr. Edward later sent me this picture of one of their patients. So we saw Fotona, we saw that it is a serious thing, and we decided to start to look into it scientifically. So not just through Facebook, but also more scientifically. And the first thing was, of course, to get a good idea about the mechanism of action, how it actually works. So I took some studies of literature, and among other, I found also this overview. It's a nice overview of hair growth and rejuvenation, looking into all possible therapies. And these authors listed here 5 different, let's say, mechanisms like angiogenesis, androgen antagonism, vasodilatation, potassium channel opening, and 5-alpha reductase inhibition. And these are, like, for them, the major non-surgical therapeutical strategies of hair growth promotion. And out of them, what I can see for lasers is definitely angiogenesis and vasodilatation. These 2 we are achieving with the warming up of the scalp and also the follicles inside the scalp. But I found another one, which was mentioned by some authors and discussed quite widely among the people using it. And this is so-called VNT beta-catenin pathway. I'm not expert in this cell biology, but I took some reading. So this is a wingless-related integration site signaling, VNT, and it goes for proteins. This is a mechanism which lets some proteins to enter the cell or not enter the cell. And the very important protein inside the cell is actually beta-catenin. So this protein, if it is healthy and, let's say, prospering in our cells, it has to be stimulated with these VNT signals. It would extend the anagen phase and delay the onset of catagen phase, which means it will prolong the life of hair shaft, hair follicles, and hair shaft. There are some nice pictures. If someone is interested to go into details, here is the literature. You can go and read it. So if this VNT port is closed, what is happening with beta-catenin start decay, start disintegrating, and this cell will soon die. But if this VNT signaling is present, then beta-catenin is stable, and this cell has a longer life. All this mechanism, how VNT is acting on the beta-catenin, especially in dermal papillary cell, which can also be pluripotent, which means they can produce different cells, including new hair cells. This is a study from China in which erbium was used to stimulate hair growth. It was done on mice, not on human. But because of that, they were able to make 4 different groups, the control group without anything, then the laser group, group with the drugs, with minoxidil, and then combination of drug and minoxidil. So when they were looking into this gene expression, they found this VNT and beta-catenin quite strong in laser. If you can look here in comparison with the control group, and if you look into the drugs, actually beta-catenin was very low in drugs. And then in combination, it did even a little bit better. So the laser has better expression of VNT10 than drugs, and in combination, it's even better. So how it affects the result? They were observing the times to change from one stage of hair growth to another stage, like telogen to anagen. It's shorter this time, better. Also from anagen to catagen, it's shorter. It's a quicker transition. It's better. So you can see here that control group has the longest times, and then the laser group actually and the drug group were approximately the same, but combination again was better. So the combination of laser plus minoxidil is giving even better result. But definitely it was shown here that erbium is efficacious in inducing the anagen phase again. So when we accepted this mechanism of action as valid background for our protocol, we start to do some studies, and I will give you a few comments about clinical evidence of HAIRestart, what we did so far. We started a study in Ljubljana. I have here still written ongoing, but this study is concluded now. We are processing the data, and the publication will come out soon. It was done by Dr. Vesna Tlaker. And actually study design was on 20 healthy patients, which has a male pattern hair loss of grade 1 to 5. As I skip over the introduction, I didn't talk about this grading of hair loss, but the most used is Hamilton-Norwood scale, which has 7 grades. So 6th and 7th grade, we think it's a too large hair loss. It's a case like on my scalp. So there is not much chances to get some regrowth. But for the 1 to 5, there are good chances. Then exclusion criteria, of course, concurrent use of some other means for improvement. And then we excluded also this 6th and 7th grade and some other type of hair loss. We are treating just androgenetic alopecia. In our protocol, we are using clinical photography of the scalp in the area of thinning. Our parameters were here similar, like with the same as this was used before. We were not concentrating on 3 to 4 passes, but on about 15 minutes of brushing of the area of thinning. And point is that the patient feels relatively hot, but not burning. And we have to part the hair to ensure maximal exposition to the skin to the laser beam. We did the bi-weekly treatments twice a week. We repeated 4 times here. And on 4th visit, participants also filled the experience questionnaire, which means about tolerability and also about satisfaction. Satisfaction was on the scale from 0 to 10 and so on. So this is Dr. Tlaker. She did her presentation last year on the LAHA symposium, and you can also watch it later on. interim results were quite promising. So now I believe when she do all the statistical processing of the final result, we will see how it comes out. This was just laser, nothing else. Here I have some video, but I have to go out of my presentation and start the video separately. Sorry for this. I hope it will be working. This video also have some sound. I can leave her to speak, and this is just about 1 minute.
And this is the treatment video, the therapy as performed by my assistant. So as you can see, it is quite easy to perform. And I would also emphasize, look at how my assistant holds the handpiece. The beauty of erbium with the stiff articulated arm is that you can adjust the counterbalance and make the treatment really, really easy for you. No, you don't need to have a hurting arm at the end of your working day. So really, look, she's just moving her wrist, and the patient is, coincidentally, he looks much like Jeff Newsier, do you agree? So it was really funny. So the patient does not feel any need for any analgesia or anything. So actually this patient reported that the treatment felt relaxing.
Okay, so I hope it will work now back. Sorry for this. I have to go back to presentation. That's it. I was already sharing the screen. Okay, guys, we are back. Sorry for this. So aside of Dr. Tlaker's study, on last year LAHA Symposium, there was a short presentation also given by Dr. Chin Chuan from Malaysia. She showed some Asian experience. She didn't have a large group of patients, but on the patient on which she was doing it, she did 2 sessions alone with 2 weeks apart and achieved some very nice improvements. So her conclusion was also that it was very promising treatment. She also did some macroscopic pictures with dermatoscopes. This is her conclusion. She saw significant hair growth, no need for anesthesia or painkiller, and so on. Jeff Newsier, who was, as I told you, the first one, also presented his result on this symposium. Again, you can watch the whole presentation there. I will just go quickly through it because it has some interesting information in. For example, in the US, it becomes quite popular. People already are selling this protocol. They are selling it for, it's about $400 per treatment, and they are doing up to 8 sessions. 15 minutes for alopecia of higher stages, which there is a higher hair loss, and longer time for lower stages. Why? Because you have to separate the hair. You spend some time of separating the hair to come to the scalp. And when he was presenting this in May 2019, there was more than 100 patients already treated, and they achieved that more than 75% restoration was achieved there. So the protocol is the same. Again, he was showing some results here. I will just skip this not to lose much time. So in summary, he said after 1 year, we found that anyone on alopecia stage 2 to 6 after a long time will not get good results. So alopecia should not be very old already. No contraindication have been discovered during this first year. Pain is less than 2, so it's very tolerable on the scale up to 10. Chiller is not needed, or Zimmer cooler, or whichever cooler. All pictures were used with permission, and only the laser was used without any other things. Again, I'm back in China, Shanghai last year. This is a Dr. Cheng Zhu, and he was presenting his work when he was using HAIRestart in combination with minoxidil. So 5% of minoxidil. So this is what I also mentioned in this Chinese study, that combination is working even better than laser alone. Of course, to prove the work of laser, we have to do some studies just with the laser, and then you can start combine as well. Or some people already start to combine immediately. you can see here really very, very nice result for this 40-year-one gentleman. And here you can see as well some of the pictures with dermatoscopes as well. Look at this.
Sorry, Zdenko, 5 minutes more, yeah.
5 minutes, okay. I'm approaching to the end, in fact. So a lot of good results by Dr. Chen as well. And I also visited the ASLMS meeting last year in March 2019. There was one lecture in which people were using not this laser, but they were using a non-ablative fractional laser of other type. And in this study, what they noticed also that the combination of laser and minoxidil is doing better than each of these alone. So here he was showing baseline, laser plus minoxidil, minoxidil only was this one. And this result were really better. Recently, we are getting such kind of pictures from all around the world. This is a short presentation from Dr. Valdivia from Costa Rica. He was also combining with PRP, and you can see really, really nice results. These are just recently received I got this from Jitendra from India, and this is just after one treatment combination laser with PRP, 1 month after the treatment. I promised you the studies. So this study is one of the few published. Dr. Gabriela Mersic, she did a Polish study with 12 patients only, but 11 out of 12 were very happy. This is available. You can get this article through mail. It's a very nice one. And then already this year in 2020 on the LAHA symposium in Russia, in Moscow, this is a case presented by Dr. Maximov, a very nice case against the combination of laser and PRP. And you can see here, this is just, I think, 2 sessions done and 5 months after. Dr. Alessia Khodova, which already I mentioned here briefly, she did a presentation on Congress in St. Petersburg, actually did more than 10 patients, I think about 20 patients, and she will publish the paper. So this is why I'm mentioning here. And what I would like also to mention that she was adding to the smooth mode erbium, she was adding also NDAC piano with these settings. And with these settings of piano, you can see very low fluence. What she's doing actually photobiomodulation. So it is adding on low light level laser therapy to the therapy with smooth erbium. So it's an additional modality. And we are looking forward to see how this will contribute. We will measure the contribution of it as well. One of the last slides is by Dr. Barry Dekesser from Belgium. He has a clinic for hair, so he's doing mostly just hair. He also has a trichoscan, and he sent me this from one of his cases, the measurement in which you can see here the change in hair diameters and also the change in hair density. If you look in this particular case on one location, because it was done on several locations on the scalp, and then make some averaging. If you look in this particular location, total hairs were before the treatment 222 per centimeter square, and after I think 4 sessions it was 380. So it's I would say 30% improvement. And also you can see the change of structure of the hair from terminal hairs, like it was 48% of terminal, 52 of vellus hair. It is after that 61% of terminal and 39 of vellus. So it means that the hairs are getting thicker as well. And lastly, it is just 2 days ago, Dr. Doris Day, she is one of the biggest user of our HAIRestart in US. She's from New York. She did a webinar on this link. I sent this link to Fascia so you can get it and you can try it. This is about a half-hour-long lecture in which she was also talking about her result in alopecia. She called it hair lace because she started before we coined the name HAIRestart. What she's doing is 8 laser sessions at 2-week intervals with P03 with classical settings as everyone else. She sent me her raw result already, and we will prepare an article and she will publish this, I hope, in a few months. You will see quite good result. And if anyone is interested to join this webinar, you have just to register with a few data. It's very simple to register, and then you can watch this webinar as well. So this is what we've done so far. what we are doing in future. We are optimizing the protocol, and here you can see something new. HAIRestart pulse is a modification of smooth pulse. We are trying to optimize the micro pulse delivering sequence to achieve even better results. Of course, we have as soon as possible to publish these 3-4 studies which were already done, and we are launching more studies to prove efficacy and safety of this treatment modality. So thank you very much for your attention. I hope I didn't exceed the time too much. I'm going back to non-shared screen, and I think now it's time for Vasya to present my colleague Anze.
Okay, thank you so much, Zdenko, for your presentation. For the participants, you can drop your question in Q&A box, yeah. Okay, next we're going to start the Dr. Anze Zorman, Dr. Anze presentation. But as usual, I will read the Dr. Anze CV first.
Sorry?
I'm going to read your CV first, yeah, Doc.
Okay.
Sorry. Sorry, wait a second. Okay. Dr. Anze Zorman graduated from Medical University of Ljubljana, Slovenia, Europe in 2013. He did his internship at the Medical Center Novo Mesto, Slovenia. From 2013 to 2015, practiced medicine at the Health Center Cezana as a general practitioner and emergency room doctor. He joined Fotona in 2015 as clinical expert, specializing in dermatology, aesthetics, and surgery. Since then, Dr. Zorman has been involved in development of new application and education of end users and partners. He is also a researcher and regular lecturer from Laser and Health Academy in Fotona. Dr. Zorman now currently works in private clinic Medilace Dermatological and Laser Center as laser expert working in the field of aesthetics. So Dr. Zorman, you can start your presentation now.
Hello, everybody. Good evening for you, I guess, because evening there. We're just preparing for lunch. So after we finish with this lecture. So as said before, I'm going to be talking about SmoothEye. And let me just share my screen. Okay. Does it work? The panelists, yes. Zdenko, does it work as it's supposed to?
Yes, it
yes.
is working.
Okay. So SmoothEye is a marketing name or a name that Fotona kind of came up. It's similar to what Zdenko was saying about HAIRestart. Like the application itself evolved on the market, and because smooth mode is used for both of the protocols that I'm going to mention in a bit, and then of course because you're doing in a periorbital area, SmoothEye is the logical assumption or the logical name that derives from it. But let me first go through some theory, let's say it like this. Zdenko was already saying about smooth mode and HAIRestart mode, which is a non-ablative use of erbium. But we have to know that primary use of erbium YAG wavelength is to, let's say, ablate, cut, to remove tissue. But why is that possible? Why does this happen? Because it's the wavelength itself is really highly absorbed in water, even more than CO2. So of course, primarily if the fluences or let's say energy density is high enough, the wavelength itself is gonna remove tissue, at least if this tissue has water. But let's say most of our tissues have water. So primarily, it would be used to, let's say, remove something like this, like fibromas, for example, or any other benign lesion. What's really nice with erbium, and especially with handpieces that you get with Dynamis, or especially the new one H14, which has a really small, actually you can choose the fiber tip, because it's a novel design of handpiece. It uses fiber tips, so you're actually working in contact, and this fiber tip can be less than 0.5 millimeter in diameter, so you can be really precise. And this, an application like this, or a removal of really small fibromas around the eyes, which is potentially a problematic procedure, can be easily and safely done. On the other hand, if you have something bigger, like a seborrheic keratosis, as this was, you can use the standard handpiece that you get with Dynamis, the R11, and you use the 2 or 3 millimeter spot size, depending on the lesion, and just remove it. And as you can see, in about 3 weeks, even sooner actually, this, but I didn't have the photo of two weeks after, but even 2 weeks after, it was the same as on day 20. So really fast recovery with with any side effects. But let's go to the smooth mode. So using erbium yak in a non-ablative way, so where the fluence used is below the ablation threshold, has been around for some time. Fotona has been, let's say, playing with it for quite a long time, and also others. This is one article from 2000, so 20 years ago, where a Slovenian researcher from one of the institutes here was using erbium yak in a repetitive motion and using sub-ablative, or let's say, yeah, quasi-ablative parameters. What did they find out? They found out that coagulation of dermal collagen can go even deeper than 200 microns below the dermoepidermal junction. So just by actually using a sequence of sub-ablative pulses, you can get effect relatively deep. And this relatively deep, I mean, in comparison to erbium yak, let's say default depth, which is few microns, depending on the fluence, of course, but primarily we would think that it will ablate few tens of microns, and that would be it. But if you use sub-ablative fluence and multiple shots, sequence of shots, you can get this heating of superficial parts. Based on this, 4 years later, another Slovenian doctor used, this time it was already smooth mode, it was already called smooth mode, and they did something similar. They actually treated, because that was done on rat skin, and this was actually done on live patients. They were actually testing different fluences, but all were sub-ablative and in a repetitive motion, like smooth mode actually is. And they also found something similar to what the previous article says. So you can actually get some denaturation or remodeling of collagen relatively deep inside with minimal or almost no epidermal damage, which is the whole point of smooth mode nowadays. Again, another study from, I think they are Germans. Again, repetitive erbium yak pulses with sub-ablative parameters were used in order to reduce the wrinkles. They also, these are some of these are the conclusions. All of these three articles are actually, I think, freely available. Full text is freely available on the web, if I remember correctly. So let's go to actually what Fotona did. Fotona used this knowledge and put together so-called smooth mode, which is a sequence of 6 pulses that are spaced apart in just the right amount of time. So ablation does not happen, at least if you go with the, let's say, an interval that is recommended to be used with smooth mode. Of course, if you would increase the fluence to maximum, that would also cause some ablation. But with the presets or with the recommended parameters, you do not get ablation. You only get hit the position which can and which is deposited relatively deep inside because of this sequencing of pulses. I'm referencing an article which actually measured this on a model. You can read about it more afterwards, but as you can see, these are two. This is directly from the model, but this is a representation how this sequence of 6 pulses, if stacked, that means that if you place multiple shots on the same place repetitively, will increase the temperature. Where did my device go? Will each time increase the temperature to about 50, 60 if we're talking about the recommended parameters, which is high enough to actually cause some reaction in the tissue. This reaction meaning remodeling of the collagen and neocollagenesis long-term in about 4 to 6 weeks. So now, let's say we know what smooth mode in itself is, what it does. So let's go to the SmoothEye itself. This is one of the, like, periorbital region is one of the quite important regions in the body, because especially now when we have our masks on and the eyes are the only thing sticking out. So I guess SmoothEye is going to be even more popular application than it was. So of course, we have different options from classical blepharoplasty, which is, of course, let's say, should be considered for those who have really loose lax skin of either upper or lower eyelids. But for those that are, let's say, low grade or medium grades, an application like SmoothEye should be considered, and it can cause, or it can be a way how to hold off the blepharoplasty for 5, 10, 15 years, or maybe blepharoplasty, for example, won't even be necessary. Since, as I mentioned before, this method, or this, let's say, SmoothEye in itself kind of evolved on the market, 2 different versions of the protocol happened, or like were present a few years ago on the market. One which is more, I call it Asian, because it's mostly done in Asian or in Eastern world, at least from where I stand, being from Slovenia, is so-called intraocular lower eyelid SmoothEye. And on the other hand, what I mostly do, and what most of the Western doctors do in most of the cases, as far as I know, is the so-called periocular SmoothEye. And this should be, I don't know what it is, like, it's periocular, so around the eye. Of course, the eye is not treated. So let's go through both of these options. As I said, in the private office where I work, in the private clinic where I work, I don't think I have ever done intraocular lower eyelid treatment. Firstly, because as soon as I tell the patient that I will put something in their eye, they say, no, you won't. And that we kind of end it there. But anyhow, on the other hand, I think I have better results as far as my experience goes with periocular, at least. But I think this is connected also to the anatomy itself. Caucasians are a bit different than Asians or Indonesians also. So I guess you have to find what works for you. As I said, for me, periocular is the way to go. Anyhow, let's go back to the slide. So intraocular lower eyelid treatment, you need, first of all, anesthetic drops. Why? Because you're going to be placing eye shields directly on the eye, on the cornea. Before putting the eye shields on, it's really nice to add some lubricant gel. This is one of the options on this photo, lower part of the screen. Why? Because if you have some lubrication in between the eye and the eye shields, patient has less discomfort. Let's say it like this. And of course, you're gonna need the PSO3 or PSO3X handpiece. X is the new handpiece, an upgrade to PSO3, which allows higher fluence to be achieved. The fluence that is needed for either intraocular or extraocular, periocular region can be and is, you're able to do it with PSO3 anyhow, and also PSO3X. So this can be used interchangeably. Dr. Kim from Korea is, if I know correctly, was one of the first, as far as I know, who proposed this this kind of treatment. As you can see, on the photo here, the eyelids are averted, the eye shields are in. That's the metallic-looking thing inside the eye, and the mucosa is treated. We'll get to the protocol itself in a minute. So, and these were some of his. This was his first kind of article, or let's say a publication about this option. He treated quite a lot, as I said, 100 patients in the first year, and he showed really nice results, which we're going to get to soon. So these are some of his results. As I said, I only have few cases of intraocular lower eyelid treatment myself. And also we, together with this doctor, we wrote an article about this intraocular lower eyelid SmoothEye treatment. You can see that the improvement after the third session, 3 sessions is kind of the protocol, is from moderate to marked improvement, and in some cases also very significant improvement. And more or less all the patients were at least partly satisfied, and some too were even, they graded their satisfaction with excellent. This article is published on LAHA webpage, so you can easily check it out if you want to after the lecture in the near future. Oh, I have a video. I was asked before if I have a video or not, but I thought that I don't have. So just quickly, this is a short part of the video, just to see how it is done. This is from Dr. Kim. As I said, the parameters and everything will be shown later. This is just about the technique itself. You will see that it's a multi-step procedure. The protocol is actually saying, or like stating, that we should start with lower fluence and lower number of stacks. Again, stacks, for those who don't know, mean shooting on the same place. Oh yeah, the video is reversed. We're going to go to the next slide and we're going to have the protocol there. So stacking means putting more pulses on the same place, and that means like 2 stacks is 2 shots, 3 stacks is 3 shots. This is sometimes people do not know what stacking means, but that's it. So as you see, a protocol by Dr. Kim using PSO3 or PSO3X handpiece with a 7mm spot size, or if somebody has really small eyes and therefore small eyelids, the spot size can of course be reduced. Smooth mode is used, and as I said previously, we are starting with lower parameters, with lower fluence, 3 joules per square centimeter, and starting with, in the first pass, only 2 stacks, and then 3 stacks, and then 4 stacks. Why do we do this? And this is something that I kind of noticed, even if we're not talking about any kind of smooth eye or anything. Like if we're talking about smooth mode treatment, let's say for tightening skin transdermally, not on mucosa, if you start with lower settings, either lower number of stacks or lower fluence, the patient will get kind of, the patient itself, like their mind or their mentally, they will get used to this heat, because the heat is there. It is a heating treatment, and while if you start low, they will kind of get used to that, and then you can increase it to the, let's say, proper parameters, and be able to proceed without, even with somebody who might even be a bit more sensitive. The logic here, as I said, is the same: lower fluence, lower number of stacks, and then you increase and you go up to 4.5 joules per square centimeter with 5 stacks. So 5 shots on the same area, and then moving the handpiece and an additional 5 stacks. Dr. Kim's protocol, as was mentioned before, says that you have to do 3 treatments in general. That's of course a rule of thumb with 2-week interval. If somebody gets better sooner, that's even better, of course, but it might be that you will need to do even 4th or 5th treatment in some cases, some worse cases. This is another case from your part of the world, let's say it like this, from Vietnam. For lower eyelid, the eye bags greatly reduced. They're still there, but they are much less visible. And this is from Japan. Again, some publications where they show really nice results and improvement in the situation in the lower eyelid. And this is one of my cases. I was actually in, I think this was also either Vietnam or, I think it was Vietnam or Thailand, 2 years ago, I think, and I treated one of their patients there as a demo patient. And this is a photo that was taken, the lower photo was taken by the doctor whose patient this was, like from the local doctor there, and sent to me. And as you can see, again, nice reduction in the volume of tissue under the eye. So this is it about the intraocular treatment. And about the second method, as I said, the periocular one, where we are actually treating the skin, not the mucosa. It's really nice, and I find it hard to do it without a nurse, without an assistant, like basically helping me, not just being there, but helping me. Why? Because you have to, like, one hand is of course holding the handpiece, the other one is not enough to stretch the eyelids, and also at the same time protect the eye from not opening. So you'll see in the photos that I'm going to show a bit later that having an extra pair of hands is really important. You need a gauze or something else to cover the eye. For this kind of treatment where the eyelid is closed, there is no need for intraocular shields. You can put them in, but in my opinion, it's not needed, and I never do it. I always, the only, let's say, safety measure is that I have my assistant there who keeps sure that the eyelids are closed. What's really important for this part of the treatment also is that you need IMLA or even something more potent. In the private clinic where I work, we use a specially prepared anesthetic cream, which consists of 20-something% lidocaine, 5% tetracaine, and few percent benzocaine. So all in all, like 30% of active ingredient, which is definitely more potent and anesthetize more than IMLA does. But if you don't have this option, then IMLA is what's usually available all over the world. And of course, again, PSO3X or PSO3 as a predecessor to PSO3X. This protocol, or the periocular treatment of SmoothEye, was kind of developed or proposed by Dr. Badawi. He's Canadian/Egyptian. So he is, this was like 2, maybe even 3 years ago. The parameters are here. As you can see, we are using similar parameters as in the intraocular one, so 3.5 to 4 joules per square centimeter, and doing 2 to 3 overlapping pulses or stacks. Again, one special, like one thing that I haven't done at start, but now I do, clean the eye, get rid of EMLA or whatever the anesthetic you're using immediately before treating. And I usually do one eye first, do the treatment on that eye, and then remove the other eye, because all of these topicals start weaning off as soon as you remove them. And let's say if it takes 5 to 10 minutes for one eye, then that means 5 to 10 minutes less effect. I mean, weaning off of for the other eye. So just take the anesthetic off one eye, do the treatment there, and then the other one. As I said before, you can see 4 arms here. Why is this important? As I said, you have to keep the eyelid closed, and you have to keep the skin stretched. And this goes for upper eyelid and lower eyelid. Why? If the eyelid is heavily wrinkled, then the penetration of what you're doing, of the laser, is not, I mean, it's still like those, I don't know, few hundred microns, but if you have wrinkles, then you're not getting to the bottom of the wrinkle because it's hidden. So stretch the eye and then go over the area. Again, as I said before, you can kind of pre-treat the patient or like prepare the patient. What I usually do before I start with the actual treatment and doing stacks of 2 or 3, I go over the area with the same parameters. So let's say 3.5, 3.75 or 4 joules per square centimeter, and just brush over the eyelid. Why? This is good, as I said before, for the patient to get to know this kind of feeling, because everybody's quite anxious because it's around the eye and it is relatively hot and for some even discomfortable. So if you start low and the patient kind of see nothing bad is going to happen, and then you can start stacking, which produces even more heat and a bit more discomfort for the patient. Also here, 3 sessions are required or like recommended as a rule of thumb. I have younger patients, or let's say with lower grade of laxity of more or less upper eyelid skin, and I do only 2 sessions maybe, but those are rare. Rarely, usually it's 3 sessions, or maybe with somebody who's almost on the border of maybe even getting a blepharoplasty, even 4 sessions. The interval here is a bit longer. According to Dr. Badawi, 4 to 6 weeks apart. I usually do it, if possible, 4 to 5, depending on how the patient can come back. So some photos from Dr. Badawi. You can see nice improvement in the periocular area and how much the eyes are kind of opened. This is another case from one of the Fotona doctors, Dr. Phillips from UK. This case is actually published on LAHA journal and on Fotona app, so you can read more about it afterwards. Another case from Dr. Badawi, and I would like to finish up with one of my, I have before and after, but I really, having photos or like doing photos of periocular area that will really nicely show the improvement is really difficult. Not just difficult, but it can be easily manipulated, in my opinion. Just by positioning the head up or down, the eyelids can look more or less wrinkled. So I'm not really that much, how to say, let's say, convinced by all of the photos. What I am convinced by is patients who are coming back, and we have plenty of those. One reason for it is this woman that is on Facebook Messenger here. She actually wrote to us. This was a month ago or so, like in September or October. One of Slovenia's aesthetic beauty influencers, and she's doing many stuff, from supplements to laser to other energy-based devices to fillers, Botox, etc. And of course makeup and all the other cosmeceuticals. She was my patient for 2 sessions, only 2 sessions in January, February, before we started with the first lockdown in Slovenia. That was in March this year. We did 2 treatments and we didn't do the 3rd treatment because we were in a lockdown already. And then we kind of forgot about everything. She came in for some other stuff, but we kind of forgot about this. And then in October, she wrote to us, or well, to our Facebook page of the clinic, that one of her followers commented about how nicely improved her eyelids are. And this was commented based on the video, which is, I think, much better than photo, because as I said, photo can easily be manipulated, let's say it like this. And on video, it's a bit different because it's like you're in motion, like things happen and you have bad and good angles in the video. So she was contacted by one of the followers, like, what did you do? I have to do the same. And that's how we kind of remembered about everything. And as you can see, and she later on put everything on in her story. And this is, unfortunately, it's relatively bad resolution because it's taken from her Instagram story, because again, it's taken from videos previously posted, but you can see nice improvement in the upper, especially in the upper eyelid. And this, again, can definitely be achieved with lasers. One thing that I forgot, everybody asks me, especially patients, what should I expect after the treatment and what to do after the treatment, of course. And first of all, during the treatment. So during the treatments, patients feel heat, but I had patients, she was actually one of those who were really discomfortable. When I asked her about how painful or discomfortable it was, she said like 8 out of 10, which is a lot. And this is not an average. An average would be 4 to 5, I would say. But we also had a patient who said like 0. And we actually called the service guy next day to check the system if everything is okay, but it was okay. So you have patients who are sensitive and you have patients who are not sensitive at all. But anyhow, most of the patients will feel heat on the treatment area. Of course, this heat can be getting towards discomfort. They might, if some patients report of actually seeing the red light, the red aiming beam through the eyelids, that's nothing to worry about. The power or the energy in the red aiming beam is negligible. You don't need protection, any kind of protection for this red aiming beam. So during the treatment, yes. So the heat is experienced by the patient. After the treatment, the area is red. Redness is present for. I had some patients where the redness was present for about 2 to 3 days, but again, this is more of an exception. Mostly, it is, let's say, a day of redness, and then this redness usually subsides in another day. So second day, it's almost completely gone. Like 3rd to 4th day, usually patients report of slight scaling of the skin. Nothing serious. They have to put some more moisturizer on, and that's it. It's not really big flakes, just like dandruff, something like that, like small pieces of skin falling off. And in the first few days, generally, it can look worse. Why? Because you kind of heated up, you, let's say, cooked the superficial skin, and this skin can look more leathery, let's say, more wrinkled, more leathery. But once the peeling starts, when the peeling stops in about, let's say, 3rd, 4th day, the skin underneath is really nice, much younger, much nicer texture. During that, immediately after the treatment, I don't prescribe anything too fancy. I use either Aquaphor or Cicaplast or Bepanthen, one of the creams that is helping skin to regenerate, and that's everything that's needed. I know that some doctors are adding relatively expensive cosmeceuticals. I think that could prove some benefit. The philosophy of let's say clinic where I work, because we are not a high-end clinic where we would only target celebrities, etc. So we have to keep our prices also reasonable. So we try to tune down the pre-treatment and post-treatment care, but this can be disputed. I mean, some doctors do use some special ointment, even PRP or PRF. I've seen or heard it used, but as I said, I don't think it's necessary for the sake of smooth eye treatment itself. But it might also do something more. That's okay. That's something that I can agree with. That would be it. Thank you for listening. And now, if you have some more questions, I'm happy to answer them as best as I can. Thank you.
Okay, thank you so much to Dr. Zorman. Wait a second. Okay. To start video. Thank you, Doctor, for your presentation about smooth eye. And we're going to answer some of the questions that had, a few of the question has been answered by Zdenko. Maybe if you want to add some, if you want to add for the questions.
So combining both inner and outer eyelid, I mean, both protocols, I don't think why it would be a problem. Definitely in terms of being too much for the tissue, no, definitely not. As I said, I personally, I've tried it with some patients. I mean, I firstly tried it in terms of telling them that we have two options, that we can do this for those that I kind of deemed this a better option. But for me, as soon as I said, like, I'm going to be putting an eye shield in your eye, they say, no, let's go with the other option. So that was kind of the reality for me. So I don't have personally experience with doing both treatments, both protocols in the same patient. But you could do it. Nothing, if you follow the protocol, nothing bad should happen. It's definitely not too hot or too much for the tissue. Do we need eye shields? No, I mean, it's, if you want to be completely safe, yes, that's like 100% safety. But I don't think, especially according to what I said, this being a relatively invasive way of protecting the eye, you don't need to. If the eyelid is closed, there's no option for the smooth mode to go through the eyelid. I mean, you would have to be shooting at the same place, I don't know, 100 shots, I don't know, a lot. And the patient would definitely be too hot and would move away. So no, I don't think it's needed. It doesn't hurt again. Zimmer, if you're talking about smooth eye and Zimmer, I personally do not use it because my logic for not using it is that if you cool down the area, and the intention is to heat it up, because that's what we want to do, you then have to increase the fluids or number of stacks to get to the same to the same temperatures as you would need. So I don't use it. I wouldn't recommend using it. I've seen people using it, and I have no comment about that. Maybe Zdenko has something more to add, but all the modeling and all the more or less all the studies that have been done, as far as I know, were done without it. So if we take into account the measurements that were done, I don't know, 60 degrees or whatever on that and that depth, we are not getting that if we're cooling, because cooling is not affecting just the superficial 10 microns. It's definitely affecting few tens, few hundreds of microns in depth. So I would say no, but again, or yes, if you increase the fluence or increase number of stacks.
Another questions, just a few questions.
And other questions, I think, for Zdenko and for the hair restart.
Yes, I'm going to read the question from Dr. Joe Harry. How long the effect on the eyelid will last? When do we need
to... yeah, I forgot to mention that. I usually say, like with most of the applications, not specific to smooth mode, but generally most of the applications where we are targeting or where we are using laser to induce heat, and this heat does the job. We are doing 2, 3, 4 treatments generally, and I'm referring also to 4D and other similar kind of from functional point of view, similar applications. So this is an initial package, as I said, 2, but mostly 3 or even 4 treatments, and then depending on the definitely effect and situation in the area and the patient's age. But I would say that kind of the shortest interval is about 6 months and up to 12 months as a maintenance treatment. But this is usually, in most of the cases, a single treatment, not more a package of 2, 3, or whatever, but a single treatment. But it's a procedure which can, in theory, be done every month if needed. I don't think the effect would be that better if you would put the interval like this. So in my with my patients, 2 to 3, maybe 4 applications in 2 to 3 months, about month apart. Then we have an interval 6 to 12 months. 6 is more for those who are a bit worse in their situation or a bit older, and 12 months or 9 months for younger patients, for mild cases where there is not so much of wrinkles or skin laxity.
Okay. Okay, another questions from Dr. Puspita Ningrum. Dear Dr. Anze, thank you for your excellent presentation. I had a case, a woman about 49 years old who has a history of atopic dermatitis, while her periocular skin in normal condition. I have had treated this patient with SmoothEye periocular for her wrinkles. The downtime is more compared to other patients, and after completely healed, she complained long-term itchiness. The parameter is about the same with what you do. Can you explain this? How to prevent this?
I didn't have this kind of patient before, so I cannot comment from personal experience. There are patients, referring to your first part of the question, there are patients who respond, let's say, worse to the treatment. They respond with more edema, they respond to longer redness, and this redness that sometimes actually kind of turns to brown color, kind of like suntan, and then peels off. I so far haven't been able to kind of guess who is this gonna be, if it's older, younger, or whatever would be a predisposing factor. Maybe this kind of condition, atopic dermatitis, could be one, definitely. How to comment on long-term itch? What does long-term mean? Like forever, or long-term like 14 days, or I don't know, a month? Anyhow, I haven't heard of this kind of problems before, and I actually do not know what to say to you. It might be, I mean, because you sometimes can have like a histamine reaction when doing smooth mode, like urticaria-like reaction. I haven't seen this around the eyes, but elsewhere on the body. And this could be kind of related to that, but it should stop in a few days, I guess. And maybe potentially antihistamines would prevent this. I'm guessing. I really don't know. Zdenko, have you heard of a case of prolonged itchiness?
No.
After SmoothEye or smooth treatments in general? I haven't. I really haven't.
No. So far, we haven't heard a lot about any side effects which will be longer lasting than a few days, which is expected, edema and so on.
Yeah.
Nothing like this.
Sorry.
Yeah, I noticed a few questions on which I was answering, typing in. So I don't know if people can see them. Someone was asking also to see the video of procedure of periorbital, and I have some video by Dr. Badavi, which was incorporated in one of my presentations. If we have time, I can show it in just several seconds. I would need to share the screen.
Okay. Do you want to share video? Okay, wait.
But I can meantime comment, because the second part of the question was also if it's safe. As I said, I've done, I don't know, a lot. Smooth eyes, I lost count, and I've never had any problem in terms of eye safety, poorer eyesight, or whatever in that context. So definitely, if the eyelid is closed, it's safe. I mean, as I said, like you would have to do 1,000 shots on the same area to go through the eyelid, then you would affect the eye itself. Okay, so here's the Dr. Badavi's video of upper eyelid.
Yeah. So I will start this video. I hope it will work. So you can hear also this shooting and interaction with the skin also leaves some sound like turn. He's doing some stacking.
These are stacks.
And what is interesting here to see is how the assistant is holding with the gauze the eye not to get open. So with this safety feature, you prevent accidental opening of the eye, and you are safe. There is another video of a lower eyelid. It's the same thing, just you pull the lower eyelid up with this gauze, and then you treat this lower eyelid in the same way. So it's very simple, in fact.
Let me just cut in. Dr. Pupita said that her post-treatment for this patient was topical antibiotic and Stratamed gel. I don't think antibiotic is needed. I never use it for subablative, non-ablative procedures, or rarely. But Stratamed is good, but Stratamed is relatively expensive. So, but if the patient has a chance, or any other kind of silicone gels, and if they can buy it and use it for the next few days instead of Cicaplast and whatever, what did I say, Aquaphor and other epithelial regenerating creams, then it's even better in my opinion. But as I said, it costs much more than any other Aquaphor or something similar. But it's a good treatment, post-treatment care. And some more questions about stacks. So yes, you have to take the word stack as being repetitive shooting on the same place. And stack 5 means 5 shots. So you're going 1, 2, 3, 4, 5, and then move 1, 2, 3, 4, 5, and then again 1, 2, 3, 4, 5. And 3 passes means that, let's say, if you have an area where you have to do 5 shots, so it's like 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 5 times, and then another pass the same, and another pass the same. This would be 5 stacks, 3 passes. I hope this makes sense now.
Okay, maybe I can answer another question which was posed by Ingrid Adelina Putri. It was about how long the HAIRestart effect lasts when you get some new hair growth and patients stop the treatment, if it will last permanently. Nothing is permanent, of course. So why people are losing hair? This is the main question. So if we are looking into androgenetic alopecia, it's mostly because of testosterone. So this is dihydrotestosterone, which is causing the thinning and dropping out of the hair, and people have this. So you have to fight it. And with the drugs, people are fighting them all the time. I would say permanently. With the laser, you get some effect, and then I would suggest maintenance treatment, maybe once a year after you reach some result, then to fight this dihydrotestosterone and thinning the hair, you should do maintenance treatment. Similarly, with all the treatments in which we are remodeling the collagen, it's not forever. We shrink the collagen, we cause some new collagen production, but then of course the time is working against us, people are getting older, also gravitation is working against us, and you have to fight it. So you fight it with maintenance treatment. It's not all the time, but once a year, let's say.
Let me take the mic. There was a question about priming the eye, or not the eye, but the periocular area. to prevent post-inflammatory hyperpigmentation. In the case of patients of situation that I have here, so this is Fitzpatrick, let's say up to 3, no need. I haven't had any problem with hyperpigmentation. I cannot be sure that this will exactly be the same for your kind of patients. It could be problematic, I would say, because of the darker skin type. So pre-treatment of the skin would be definitely safer. But I don't personally know how is it exactly with smooth mode on the a little bit darker skin. Generally speaking, you should use lower fluence or lower number of stacks and be more cautious. But if it's needed to do pre-treatment care in terms of post-inflammatory hyperpigmentation prevention, I'm not really sure. Zdenko, your comments?
Oh, sorry, I was just responding to another question.
Sorry. No, the comments about pre-treatment in order to prevent post-inflammatory hyperpigmentation in darker skin types.
Yeah, of course. In Asia, it's a big issue, and this is why people are very cautious when they use any heat on the skin. But smooth mode is quite safe. It was shown in the past 10 years, I would say. If you are looking into studies which are done, for example, in Bangkok, Professor Manuskiati did quite some studies with smooth mode and found relatively low PIH incidence. So it is possible, of course, but you can prevent it, as this doctor asked in a question. If you do some pre-treatment, you can reduce even this small possibility.
Yeah, that's gonna make it safer for sure. But on the other hand, now that I'm thinking, Dr. Badawi, who's Egyptian by nationality, but also working in Canada, has a lot of darker skin patient, and he's not, as far as I know, he's not specifically recommending this.
Maybe just this information. He wrote an article about SmoothEye with his experiences. I believe it was 40 patients treated, most of them Middle East patients. And this article will come out soon, I believe in a couple of months. So you will get it when it comes out.
Another question about safety. So if we accidentally shoot at an open eye, definitely do not do that with NDIAC. But with erbium YAG, if you accidentally shoot, that means like one shot or not even complete smooth mode, so 6 shots. I don't think that's a problem. I've done it before, and it results in something similar to, let's say, it's a corneal erosion, like you would be scratching your eye, even not that much. But this should be one shot at all, like not more, and then you should kind of figure out that what you're doing should stop and you should close the patient's eye. But one shot or so doesn't matter.
If we are looking into the physics of this particular wavelengths, as Anze said, NDIAG wavelength is penetrating through and coming to your retina, while erbium YAG is stopped already by cornea. So all the absorption will happen in cornea. If you shoot at cornea, it will absorb it. And then it depends on intensity. If intensity is high enough, it will do some ablation. If not, it will do just some warming. But don't do this by purpose, please.
Yeah.
Another question from Dr. Natalia. To Zdenko, may I ask if maintenance is needed after the hair has completely grown?
Yeah, I think I already answered this question because just before I was discussing this, that nothing is forever and so on, that you do once a year a maintenance treatment. I saw among the questions 3 or 4 doctors asking the same thing. So I believe it was already answered there.
To the next question from Dr. Amaranila. All AGA patients that you mentioned with good results, for how long the results stay after the procedures? Do the results stay for good?
Yeah, it's difficult for us to say because as you saw from my presentation, for us, it's a relatively new protocol. So it is now on the market, or let's say it's used by our users less than 2 years. So definitely 2 years will stay. And again, as I said, the body is working against it. So the dihydrotestosterone will work against it, and you have to do some maintenance.
Okay. Okay, another question from Dr. Puspita Ningrum. Dear Zdenko, thank you for excellent presentation. Do you have study or experiences for maintenance hair laser treatment for AGA? Is it only laser or combined with tropical or other treatment?
Yeah, so far we have just a few studies. This one, which was done in Ljubljana, is pure lasers. The studies which I showed from China and also from Russia is combination of PRP. Well, we are looking forward. I hope in a few months, let's say in 3 months, we will have like 4 or 5 papers to show. But also the study of others, not only ours, it's showing that combination is giving you better results, meaning the contribution of both components is significant. And the investigator from Belgium, which I mentioned, Dr. Berry, he is using combinations and he is very happy with the results. So I believe at the end, it will be the combination, which will be the, let's say, winner.
Okay, for the last question from Dr. Ingrid Adelina Putri. If the hair already cover all the scalp, do the new condition will be permanent, which means the hair will do not fall again and back to the bald again? Do we need some maintenance hairless treatment after a few months after?
Yeah, I would say this is the same type of question, so it is already answered.
Okay.
Okay, so another question about COVID situation. SmoothEye, I don't see a problem. Well, yeah, you know, there are supposed to be viral particles in the excretion or in the tears, but again, I don't think that's a problem. Different thing is about intraoral procedure. Nowadays, well, from like, I can only answer how we do it. So when we were closed in March, we were actually closed and we didn't do anything. Now we are still doing things, and we are also doing intraoral. So what do I do differently than before? I, of course, wearing all the, well, I don't do it in a full suit, but I have either FFP2 or FFP3 mask. And what I add, after intraoral step, I change the gloves, I wipe down the handpiece, and everything that I could touch or I did touch during that first step, or the only step if you only do that. But that's it. Other than that, I do it. But but today I've been tested, so we'll see, because it's a regular testing. So we'll see what happens.
I will maybe just give one comment to the lady who was asking about this atopic dermatitis patient and itchiness. So just for your information, we have some experience with atopic dermatitis, treating it with Nd:YAG. With long pulse Nd:YAG and also with the refractory Nd:YAG, we are achieving quite a nice reduction of appearance of atopic dermatitis. You don't get rid of it, but you can improve the situation. Just recently, I did one colleague in Fotona with the refractory, and her skin improved tremendously after single treatment. So we don't have yet.
But keep in mind, eyes. I mean, just the eye shields.
Yeah, of course. I just wanted to finish this with, we don't have this clinically validated, but this is like anecdotal cases. We will work on it because it's a huge indication, and it seems that Nd:YAG has this anti-inflammatory effect, and it is helping. And of course, as Anze said, if you intend to treat this atopic dermatitis on the eyelid, then put the eye shields in.
Definitely.
And please, if you are using eye shields, don't use plastic eye shields, because there was a case described, I have somewhere this case written, about the melting of plastic eye shields under the eyelid after the use of Nd:YAG. Nd:YAG was used for vascular treatment on the eyelid, and the quite strong long pulse shots were done. And these shots were so strong that the plastic get glued to the upper eyelid. So metal eye shields, please.
And even with those metal eye shields, they won't get, of course, they won't get melted. But keep in mind that they do retain some of the energy and some of the heat. So if you're doing anything with either higher power, high fluence, or for a longer period of time, keep in mind that the eye shields can get hot or hotter. So have some pause in between or something, or check it. But the patient will usually tell you that it's getting hot. But again, just to have it in mind.
Okay, maybe this is the last question before we finish this webinar. Do you combine fractional air YAG and PS O3 HAIRestart at same session?
Well, in the same session, I wouldn't do this, but because usually if you use short pauses or if you use even long pauses and go deep enough, it will cause some bleeding. So if people, I think the people who are doing a fractional ablative erbium YAG is doing this as a single therapy. Not, I mean, not connected with the smooth mode or something else. You can connect it with the topical ointment. When you pre-drill the skull, you open the canals, actually open the canals for the drugs that they can penetrate deeper into the scalp. And this is what people do. They do pre-drilling and then they put ointment on it, yes. But not the smooth mode on top of it.
Okay, we don't have any questions anymore. Thank you so much to Dr. Zorman and Zdenko for answering all the questions and also for the informative and interesting talk, and also for the participants. Thank you for your giving us questions during this webinar. And let's wrap up this webinar. On behalf of PT Admiral Blesen Sahabadi, I would like to say thanks again to Zdenko and Dr. Zorman for your informative and interesting talk. It was a pleasure to have both of you with us tonight in this session. Dan untuk para peserta yang sudah menghadiri dari awal sampai akhir webinar, terima kasih atas kehadirannya. I hope this session will be beneficial for everybody. Selain itu, dengan senang hati kami umumkan bahwa kami dari PT Admiral Blesen Sahabadi selaku perwakilan Fotona Indonesia akan melakukan webinar-webinar selanjutnya dengan topik dan berbicara yang berbeda-beda, baik dari lokal maupun internasional. Okay, thank you for your attention.
Yeah. I would like to say goodbye to all my Indonesian friends, and I hope to see them in live next year.
Okay, thank you so much, Zdenko and Dr.
Thank you and good night.
Good night. Have a good rest of your day. Thank you.
Bye.